welcome to the Tai Chi for Therapists podcast, where we explore the evidence and practice of Tai Chi and Qigong in clinical settings. Welcome to episode 5.
Hi, my name's Helen Parsons, and this week we're taking a step back to look at the wider perspective of physical activity and sport and the important role they play in health and well-being. And to help us with this wider perspective, we have special guest Lisa Westhorpe, an occupational therapist from Sport for Confidence. Hi, Lisa. Thanks
Thank you
for
for
joining
having
us.
me. Great to be here.
Thank you so much for joining us. Would you like to briefly describe Sport for Confidence and sort of where you are in the country and what you do?
Absolutely. Sport for Confidence are a community interest company, and we reduce health inequalities through providing access to physical activity opportunities. So that looks like a lot of the time a traditional model, which might be within a leisure centre. So placing occupational therapists and sports coaches into a leisure centre to provide opportunities for physical activity. We also work with GP surgery, so working in primary care. Also thinking about some of the kind of broader services that we work with in terms of long COVID services and also our national work as well, which I'm part of. So within Sport for Confidence, most of our delivery sites, as we would call them, are in the southeast of England. But we also have a national team, a national space, that we support that delivery model to amplify the messaging and the things that we're learning within that space on a more national level. Myself and we have a small team who work to kind of support the spreading of that kind of messaging across systems, which is really exciting and something that as an occupational therapist wasn't kind of a traditional OT role that I thought that I might have at some point, which is very exciting.
Would you like to describe, like say it's such a new role in a way, would you like to describe a little bit more about what your day-to-day looks like?
Absolutely. So we do a lot of connecting across systems. So that might look like working with universities, so lecturing to students, taking students on placements, working with universities on their curriculum as well to include physical activity as part of their curriculum. So we're doing a piece of work with Teesside University at the moment to support the development of their curriculum with physical activity being at the heart of that. Um, Also working with partners across the system. So we are a Sport England systems partner. So we get a small amount of money from Sport England to be able to, think about the delivery work that we're doing and how we can take that learning and share it with other organisations. So we have projects, for example, that we work with Activity Alliance, who are doing a project with us around kind of volunteering and paid employment and how we can support people with long-term health conditions or disabilities into those roles and accessing physical activity. So it's very much working with any partners who are interested, and that might look like NHS trusts, it might look like other kind of voluntary organisations, it might look like local government. It just depends who's interested and who wants to integrate physical activity as part of their work. And I think occupational therapists are really well placed because we do work across a lot of those organisations. So yeah, that's my little shout out to
Amazing.
OT there.
Amazing, yeah. Like I say, I just love the versatility of OT. I love the ability, like I say, to work across a range of settings and kind of, yeah, and bring a really unique perspective. But kind of going back to the more face-to-face side that kind of happens in the southeast, I just wondered if you'd like to kind of explain it from the participants side there in terms of how do people find out about Sport for Confidence, or how are they referred? Do they get referred in? Do they stumble across you themselves? What's the process for the people coming and accessing your sessions?
Absolutely. So we would have what we call a single point of access. So we have an occupational therapist who talks to everybody who's referred in, and it might be the person themselves, a self-referral, it might be a healthcare professional that might refer that person in with their consent, it might be a person supporting that individual who would refer them in. Um, it depends. We take referrals from pretty much anywhere, and we are a no labels model. So anybody age 16 plus who requires support to access physical activity can access our services. So it's really getting that occupational therapy perspective from the start of their interaction with our organisation, getting that really kind of holistic view, making sure that they're accessing the services that they need to, whether that's us and they get referred into one of our services, or whether that's somebody different and we onward refer within the system. So we also just kind of thinking about how that journey looks for participants. There are opportunities for participants to volunteer within the organisation as well. So we have assistant coaches and volunteers who maybe have been coming to our services for a while, and one of their goals might be developing some of their skills to volunteer elsewhere or paid employment in the future. And as part of that process, that's something that we offer. It's really I would say our kind of superpower is that triangle between an occupational therapist, an inclusive sports coach, and the person with lived experience, and whether that's the participant or whether they're in a kind of coaching or volunteering role.
Amazing. Yeah, I love it. Coming, like I say, the OT perspective really brings like the person-centered model, doesn't it, forward? Yeah, and like I say, avoiding the labels, just seeing the person such an enabling way to begin the process. I know when we've chatted before, they kind of talk about why the need for the service. There's a lot of barriers to people accessing something that some of us take for granted in terms of walking into a leisure centre. But could you describe some of the barriers that people might be experiencing in terms of accessing, physical activity and because of that, facing, health inequalities?
Absolutely. I think barriers can look very different depending on who the person is who's being referred into us. So that barrier might be something that has happened to that person. It might be that there's been a change in a long-term health condition or in life circumstances that has meant that, maybe something that they've done previously, and that might include physical activity, has been off the table for them for a while. And maybe that's something that we can support them to come back to. But I think there is also should it really just be an individual level where the barriers are? I think, we need to look more at the systems that support people to be physically active and how we can advocate for people as well and with people to kind of amplify their voices within the system. So making sure that, that leisure centres and other community assets are accessible to people. Um, whatever that looks like. I mean, we think about accessibility in terms of the facilities sometimes and the built environment, but is it a welcoming space as well? Do people feel like they can really be part of that, and do they have that sense of belonging, or is a leisure centre somewhere that they would never normally walk into? So part of our work is around supporting people to access a potentially completely new environment as well.
Yeah, I think I can relate to this, having acquired my disabilities, Lisa, and then encountered lots of those barriers, as you pointed out, in my attempts by myself to kind of get back into sport and physical activity. And yes, as you say, people make a bit of an emphasis about physical accessibility, but that's only part of the story. And in many respects, it's the attitudes and perceptions that staff teams within facilities have that can actually be the make or break. You can have as many ramps and accessible lifts, etc., as you like, but if the staff team aren't prepared and trained and expecting to work well with people who are experiencing these barriers, then yeah, it can be a real put off.
Absolutely. I think there is a huge point there around, it can be a bit of a checkbox exercise, can't it? That we've got this accessible whatever it is, maybe they've got a pool pod and which allows people to access a swimming pool, but if none of the staff are confident or know how to use it, then it is just a checkbox exercise. They've got that piece of equipment that probably costs thousands of pounds, but still nobody is being supported to use that facility because of that kind of staff perception. And part of our role within leisure centres is kind of that mentoring and training of staff and helping them to feel confident in terms of interacting with people with lived experience.
Yeah, absolutely. And I think that, again, from my experience and talking to other people with disabilities, it provokes a lot of anxiety that ought not to be there, because if I'm unsure of what I can or cannot do, or I'm unsure that I'm not whether I'm going to get the support that I need, then ultimately, even if I start a physical activity, that chips away, and it makes it easier for me to slowly but surely disengage, because that uncertainty just isn't worth me dealing with on a week by week basis. So I may go with all of the best intentions and motivations, but over time I'll drop out, because it's just too much emotional labour basically for me to invest in this activity, because of all of that uncertainty as well.
You're having to constantly advocate for yourself.
Yeah,
There's no support in terms of, positive risk taking. It's you having to advocate for, well, actually, I am going to do this, and here's, how I plan to do it. It's having that support and that positive perception that people can, rather than, I think a lot of healthcare services tend to look at people from a risk perception, and how can we support people to be safe, and actually people don't get out of bed in the morning necessarily to be safe. They want to go and do their meaningful occupations, and that involves some risk sometimes. Yeah.
absolutely.
Yeah, thanks. It's a really nice to bring some of this personal feeling behind that. What, because we can talk about goals and or strategies, can't we? And then sometimes it's like to say, it's very much a lived experience, isn't it, that makes us engage with or really understand what it is and what becomes meaningful. I don't know whether you've got any other examples or case studies from Sport for Confidence where you've kind of been able to maybe to chip away some of the barriers or encourage positive risk taking or help people navigate through services.
I think one of the case studies that we've kind of recently shared within the system was a young person who was an asylum seeker, and who was uh, I believe a Paralympian in the past. So was, very experienced in accessing physical activity opportunities. But in terms of the barriers that that person was, experiencing because of the system that they were within, not being able to access even things that we might take for granted, like, a wheelchair if that person needed to move around in the environment. And our occupational therapist was able to support that person to be able to access the leisure centre facility. And, there was a great conversation around that feeling of belonging and, being able to return to meaningful occupation, um, it not being, that there were barriers in place. Here was a person who really wanted to support that person, and just a really positive experience, I think, for both sides, in terms of the healthcare professional learning a lot more about the asylum process and what this person was experiencing, but also for the person who could then get back to their meaningful activities. So yeah, that was fantastic. And I definitely didn't cry at all while I read that case study. Talk to that OC.
Wow. Yeah, it just, like you say, sometimes, yeah, just the scope that you have to really impact on someone's well-being. I don't know if you want to talk a bit more about the collaboration that you need to do in order to break down barriers that can exclude people. Well, we kind of think these are maybe small things, but they they build up, don't they? And they eventually create big barriers that people can't chip away at themselves often.
Yeah, I think there's lots of levels, I suppose, to this in terms of collaboration that we do as part of Sport for Confidence, whether that's, on a local level, whether that's, those onward referrals and visits from other healthcare professionals so that they're aware of what we're doing, whether it's just looking out from your usual practice and going, what else is around? It's really difficult on a day-to-day basis to do that because we're all under so much pressure in terms of meeting, working with waiting lists, meeting our targets, seeing as many people as we can on those waiting lists. Um, it's really tricky to do that, but I think the more that we do it, the more things join up across the system, and it makes more sense for the people using those systems and those services. So there's that very kind of local led kind of collaboration, but also, thinking about on a national level as well, those collaborations that we can. I feel like as occupational therapists, we have such a good, that dual training really comes through in terms of physical and mental health, our kind of holistic view, which I think we take for granted. But if you say things to the rest of the system about that, they go, "Oh, that's interesting." And just working with a lot of different partners across the system, and whether that's, as I mentioned earlier, kind of those education partners, so that we can influence the practice of future healthcare professionals, whether that's leisure providers. So we work with Everyone Active, for example, as one of the leisure providers that we work with in their leisure centres, or whether that's other organisations such as Activity Alliance, whether that's other partners kind of across the system and NHS Trust. So I think collaboration is key. It's a massive part of making sure that services work for the people using those services.
It sounds wonderful that you've got this like a dual-pronged approach. You've kind of got this top-down, trying to influence the new OTs and other services, as well as working directly with people using services themselves. And I think OTs do bring an interesting perspective where kind of I think we already have some problem-solving abilities as well, and we also kind of bring this biopsychosocial approach or perspective, don't we? And I think we understand what a meaningful occupation is and how important that is. It's not just something nice to have. It's really vital for our health and well-being. And we stand out because we synthesize this biological, psychological, social domains. We bring them together, and like we've discussed already, we bring the person as an active participant, not somebody that's just being done to, and we can kind of simultaneously problem solve. And despite all this, we've got sports and physical activity, which is kind of very much has these biopsychosocial approach, and yet OTs don't see themselves perhaps in that space. We've got sport and physical activity, a real biopsychosocial approach to people, and yet OTs don't see ourselves in that space. What do you think to that? What would you say to that?
I agree that I think OTs don't always feel very confident in this space, which is a shame because I think we do have a lot to offer. I think there is a big thing there around confidence and people's perceptions of sport and physical activity and their own experience of what that looks like for them. Um, Also, that idea that maybe I have to be an expert in sport and physical activity to be able to offer any kind of intervention around that. And I think a lot of the time, we talk to people about how, as an occupational therapist in a leisure centre, you're using your OT skills in the same way that you would in any other setting. You're still an OT, you're just doing OT in a slightly different setting. You're still using all those skills, and using physical activity as a tool to be able to support people towards their goals, rather than it being, I'm suddenly a sports coach and I need to know how to play all the sports and do that at an elite level so that I feel confident in being able to, offer any kind of physical activity support to people. It's actually just if sport or physical activity is a meaningful occupation, we just use our activity analysis skills to break that down and support them to be able to access it in the same way we would for any occupation. So it is just increasing OT's confidence in being able to do that and pointing out that to some extent they probably already do it. And there aren't very many occupations that you can do without moving. So physical activity, is part of pretty much all the occupations that people might want or need to do. So, if you're doing any occupational focused practice, you're probably using movement in that, and that we should be confident in including that as being part of our practice because we kind of already do it. It's not necessarily a role emerging area of practice. It's just an area of practice that we haven't maybe realised that we're already engaged with.
Yeah, fantastic. Yeah, I think this idea that perhaps, yes, I like the idea of, kind of getting a little bit intimidated. I think a lot of us can be intimidated by sport, can't we? And
Yeah.
think of it as kind of sometimes has a very elitist ideals to it, doesn't it? Oh, I can't go in there because I have the lycra on, or I don't have the right outfit, or I'm not skilled enough, or I'm not young enough, or I'm not able enough. So from both the, as an average person trying to access a physical activity or a leisure pursuit, or like say being a health professional, kind of going, am I allowed to be in this realm? Am I allowed to be here? Is this for me? So I kind of think, yeah, we just need to break it down, don't we? It's a physical activity, isn't it? And recent research has shown the multiple mechanisms behind mental health and the mental health benefits, I should say, behind physical activity, that we know that getting physically active does so much for our health and well-being, and we don't often put that much thought into what is creating the benefits. Some people, it's, you've just got to go for the runner's high. It's just a burst of, hormones or endorphins or something that make us feel better. But we've had this really nice bit of research recently that talks about, some of those mechanisms. And I think, again, this speaks a little bit to, how great a fit OT is for working with those mechanisms and personalizing it for an individual, saying, okay, I've got somebody, how do I then get all the benefits from this physical activity for
And we're
them?
going to put this in the show notes, aren't we?
Absolutely. So this is a recent paper from Why to Tell 2024. We'll get that link for the show notes. But yeah, it really highlights so many psychological mechanisms behind the benefits, such as self-efficacy, body image, resilience, building self-esteem, feeling our physical self-worth, emotional regulation, mindfulness, life satisfaction, mastery, just a whole raft of things just in the psychological mechanisms alone. And then we have the social mechanisms. So this really speaks to our biopsychosocial model, doesn't it? We've got the psychological mechanisms, then we've got the social mechanisms of social support, social connections, sense of belonging. And we understand that as OTs as sometimes as our, occupational identity. And also, and socializing. But then we know about the physiological mechanisms, better function, reducing inflammation, reducing pain, all those kind of reducing fatigue. Those are all the underlying basic physiological mechanisms. But so much there to chip away at as OTs. We can start at any point within that. Any thoughts on, like I say, this is kind of fairly recent research. Any thoughts on that, Lisa?
Yeah, I mean, I love this paper. And I love the fact that they've produced an infographic that goes with it that really explains it really well and really clearly. I wish more research papers did that. But I think it really backs up occupational therapy as part of sport and physical activity, because I think a lot of professions might look at that and go, oh, they're talking about the psychological mechanisms. And I only think about physical activity from a physical perspective. I know that the benefits are really great in terms of, physical health, but maybe I hadn't considered that there was a real positive psychological impact on people. Whereas, Lindsay, who founded Sport for Confidence, called it Sport for Confidence because of that link between being involved in physical activity and how you feel, not just, it's not sport for reducing your risk of diabetes, it's sport for confidence. And that's really important, I think, for us to acknowledge that as OTs, we kind of understand that implicitly, that there's that link between what you do and your health. It's that occupation and health link, isn't it? And that's part of our training and something that we understand. So I love this study. I think it's brilliant. And I think as OTs, we're not always the best at doing research, but I think a lot of research from other disciplines backs up what we do and really supports our ability to be part of this conversation and part of this space.
Absolutely. Yeah, I think this idea that we can, when we understand the mechanisms, so to have this paper which really delved into the mechanisms, really helps us as OTs explain, yes, there's more to this than meets the eye. And again, that's it. What people don't understand is occupation. It's just something that we do. OTs are great at unpicking it, doing that analysis and finding what the mechanisms are. And this just, like I say, it comes from a different area. It wasn't, like I say, it wasn't done by OTs, but yeah, it really helps justify, what we're doing and why we do it. And that we do need to think about how we present activities sometimes. We can't just throw people into an activity and push them through the door and say, get on with it, you'll be fine. We do need to have, be building activities that create a sense of accomplishment, so that they're at the right level. People need to have a level that's accessible, that has the right level of challenge, that's also supportive, that might allow other things. Like, obviously we talk a lot about mindfulness. We teach Tai Chi, and those elements where you're stop ruminative thought, you're just for that time become a little bit more just aware of what you're doing, more mindful about what you're doing. You get more absorbed in it. You start to get feelings of, skill or mastery or self-efficacy when you've done it a few times. You get, you change your occupational identity through doing the sport. And so I think this is it's a lovely. I think there's much more to be got out of this paper. I'm going to go back and give it another dive into. So,
I think, well, it's just going to chip it. I think for me, when I was reading widely, about the origins of the Paralympics, what struck me was just how occupational therapists were instrumental in being part of the inspiration for Dr. Ludwig Guttmann to go on and create what we now know as the Paralympics. It was the OTs who facilitated and enabled the male and female patients there. Sometimes we don't realise female patients were at Stoke Mandeville in the 40s as well. To turn their crutches upside down and play games of hockey. And again, it was just one of those aspects where OTs are facilitating a game, a sport, with people with spinal injuries, and that beginning to become the inspiration for what we now see as the Paralympics. So I always kind of like that, because it kind of shows and hopefully gives occupational therapists in this space the confidence, as you say, Lisa, to actually go, you know what, we have a place here, and actually as facilitators, we absolutely are the right person to be doing this with people.
I love that example, because I think that really speaks to OTs, supporting people to be creative and to do the occupations that they want to do. I don't think anybody would come along and prescribe the people in that hospital at that time, to tell them to do a certain thing with their crutches and to, to do that. But actually, they creatively came up with something that occupied them, And the OTs there realized that that was really supporting their health and well-being to be engaged in that. And I think that's just such a nice example of, OTs being involved. And yeah, you're right, Phil. It definitely is a great way for us to look as OTs at how we've always been involved with physical activity. We might just not have realized it. And it might not have been promoted maybe in the same way as other professions.
Absolutely.
Yeah. So from our, like you say, from a bit of this hidden history that we might not talk about or shout about much as OTs, where do you think we're going next? Looking to the future, where do you see the role of OT evolving?
I see OTs everywhere, but that's just me. I think we could put OTs anywhere and they would be valuable and needed. I think a lot of the policy and kind of strategies that are coming out support that as well. So we have, the Royal College of Occupational Therapists workforce strategy has recently come out for England. And I know there'll be ones following for the other countries within the United Kingdom. And there's a huge focus there on moving towards prevention and moving towards a community-based focus rather than acute care, supporting people where they are rather than as only being placed in very medical environments. So I think sport for confidence is already kind of showing that can be a thing that happens in OT, and I just hope that there are OTs out there who look at that and think, I can do something different too. This isn't about recreating what other people are doing. This isn't about we all have to do things the same way. As occupational therapists, we are very creative and innovative, and we can support people to solve problems, and to, orientate services so they work for the people that they should be working for. So I hope that I see in the future more OTs, for example, in commissioning roles, in more senior roles where they can influence the system as well. There are lots of, ways that we can think about how OTs could work in areas where they're not working at the moment. So, for example, in the States, there's quite a lot of OTs who work in pelvic health or maternal health, thinking about that kind of preventative approach. So yeah, I'd put an OT everywhere, I think would be my answer to that.
Awesome, awesome. The future's OT.
Yeah.
So, what advice would you give to OTs at the moment who this has inspired them? They've been thinking about maybe, and they're a little bit inspired to maybe take the next step. What would you say?
I think seek out like-minded people, whether that's other occupational therapists or other people that you know of in your, service or system. Um, I think as OTs, we tend to try and seek out more training on things, which is a good thing to do. I'm not going to say, CPD isn't valuable, but sometimes it's about having conversations and trying things, with the appropriate permissions within your service, obviously, disclaimer there. But I think it is important that we do some doing and kind of reflect on that doing rather than thinking, oh, well, maybe somebody will change that eventually. It's up to us to change it. We can be brave as OTs, and we can think about, how we can affect and outwardly push on our kind of sphere of influence a little bit.
Awesome, awesome. And how would people find out more about Sport for Confidence or any support that you could give to OTs in this direction?
Absolutely. So we have a Moving OTs community of practice, which if you go on the website, there is a tab for that. So our website is sportforconfidence.com, no dots, no dashes. And yeah, I would encourage people to come along to the community of practice. It's once every 2 months. And it's usually an evening time, so it's more accessible for people. Obviously, during the working day, people can't take the time out, obviously, to be able to come along. So we try and do it of an evening, and it's just a way to connect with other occupational therapists who are either interested in physical activity as being part of their practice or are already including physical activity as part of their work. So sometimes people are coming along because they're not doing physical activity as part of their practice yet, but they're very interested. They want some hints or tips on how to incorporate that as part of their day-to-day work. And we have speakers from, well, across the country. But I want to say we do have international speakers as well, which is fantastic. Um, so it's just a really nice space for people to connect with like-minded occupational therapists. So yeah, we have our website. You can connect with us, and also on social media. So we're on Instagram as Sport for Confidence. We're on X as Moving OTs, and we're also on LinkedIn.
Fantastic, fantastic. And I believe you're on YouTube. I think you can get the Moving
Yes.
OTs, the previous Moving OTs sessions are up on YouTube. Is that right?
Yes, so we have a YouTube channel. So if you search for Sport for Confidence, all of our videos should come up as part of that. So that's any videos that we've produced as part of the Moving OTs community of practice, but also other videos that we've put together as part of promoting occupational therapy from the last few years. So it's definitely worth checking out. Thank you for reminding me.
No worries. It's a great resource, only because we're on there as well. Only joking, only joking.
Yes.
Yeah, we've done. We were delighted to be asked by Sport for Confidence to come and do a talk for Moving OTs. So you'll see me up there talking about Tai Chi and Qigong and what they can offer for to OTs. So yeah, but there's so many more great videos in there. It's a great resource to drop into. And so finally, before we sign off today, is there anything that we haven't talked about that you would like to have included in today's session?
Suppose we touched on it a little bit earlier, but just really encouraging occupational therapists to be brave, making sure that if what we're doing doesn't align with what we think we can do as occupational therapists, we can change that. Whether you think you can change it or you think you can't change it, you're probably right. So let's think that we can change it. We can go out there and do things differently. I think our perspective is often different than others within systems, and that's a positive thing, and people are receptive. So don't be afraid to be brave, I think is my takeaway.
Wonderful, a fantastic message, very optimistic, and yeah, let's use all our skills, our problem-solving skills, all those things to be brave and get out there and yeah, break down some barriers along the way. So thank you so much for joining us, Lisa. It's been fascinating to have this chat with you, find out more about Sport for Confidence and what they do, and kind of shine that light on physical activity and the mechanisms behind it. So thank you so much again for joining us, Lisa.
Yeah,
Thank
thank
you
you,
for having
Lisa.
me.
And may we wish you a Merry Christmas and a Happy New Year as well.
Happy Christmas and Happy New Year to both of you as well. Thank you for having me.
You're very welcome. Take care. Bye-bye. You've been listening to a Tai Chi for Therapists podcast. If you'd like to find out more about our course aimed at rehabilitation professionals called Tai Chi for Therapists, then please visit our website at www.discovertaichi.uk.